Thank you very much, and good morning, everybody, and thank you for inviting me to close your virtual conference week, and well done for persevering through the IT issues that I understand you've had, and hopefully this morning it will be plain sailing. So without further ado, I'm following the theme of the week, which is about thinking family, and I'm going to talk about some human stories that emerge from Safeguarding Adult Reviews and that give us food for thought about how close we get to the evidence base about best practice when working with individuals and their families and wider networks. So this is about learning from Safeguarding Adult Reviews. The slides should be available in handout form if you haven't had them already. I'm sure the Keeping Bristol Safe partnership will ensure you have them subsequently. So I'm drawing on, in the main, two sources of evidence. With Susie Bray and Research in Practice, I've just completed the first ever national analysis of SARS in England, covering the period April 2017 to March 2019. There were 231 SARS, most published, but some not, in the sample. And 12 of them specifically focus to some degree on the subject of this week's virtual conference, namely thinking family. And those cases principally revolve around domestic abuse, self-neglect, physical abuse, transitions, and relationships between the cared for person and the carer. That national analysis will be published on the Local Government Association website in a few weeks' time, and I shall be disseminating it to Safeguarding Adult boards within the next couple of weeks in a PDF version ahead of publication, and the reference is given at the end of the slides. The other source of evidence is a self-neglect database, which I've maintained for the last few years, and if you are a reader of the Journal of Adult Protection, you will find annual updates from me about self-neglect and the learning from Safeguarding Adult Reviews in respect of that type of abuse and neglect. And there is learning there too about Think Family, including, importantly, the impact of adverse childhood experiences on younger adults and indeed older adults, and our need to be aware of the impact of trauma and loss on people's lived experience and life journeys. So, a number of human stories that illustrate the importance of thinking family. And no better place to start than Bristol. And you'll find the Safeguarding Adult Review on Christopher on the Bristol Safeguarding Adult Board website. Christopher had lived with his father and had had significant involvement with his extended family for the majority of his life. And indeed, those arrangements would have continued had it not been for the fact that his father had a serious illness from which fortunately he recovered. But that prompted his father and the wider family to think about Christopher in the longer term. And as a result of that thinking, Christopher moved into supported living, and he resided there until he died in hospital some 18 months later. from the initial move. One key piece of learning in this SAR was that the family had provided extensive details of how to manage Christopher's disabilities and how to meet his care and support needs. A very detailed document summarising everything they had learned about looking after Christopher. And it was by no means clear what notice had been paid to the information that the family had provided. Another key piece of learning was that Christopher had been used to periods of respite care, but had not lived permanently away from home for some considerable time, certainly not since his period being educated as a child. And those involved probably underestimated the impact on Christopher of moving from his family into independent living. And when things began to deteriorate for Christopher after his move, the key piece of learning was the degree to which the family's voice, the family's advice, the family's guidance to those with day-to-day caring responsibility for Christopher were listened to and welcomed. And I think it's no exaggeration to say that at least for some of the time, Christopher's father and indeed partner and other members of the extended family felt shut out by the staff looking after Christopher in independent living. So it raises questions about the inclusion of family members in planning and for and meeting a person's care and support needs when they are living independently. It raises questions about the degree to which an individual's autonomy and self-determination has to be balanced against a duty of care and the family's involvement in contributing towards meeting that duty of care. So here is the second of the human stories, and this is about Andy, and you can find the story of Andy on the Salford Safeguarding Adult Board website. And you can see, broadly speaking, on this slide, the key points in relation to Andy's story. Andy had, as a young person, ambitions to be an active sports person. He was an active footballer in his younger life. He also had ambitions to join uniformed services, especially the army. And when that fell through because of an acquired life-limiting illness, the first of several that he acquired, he had ambitions to train as a chef, and indeed had started that apprenticeship. However, Andy's life deteriorated in the sense that he acquired three potentially life-limiting and certainly severely disabling illnesses, and one of which was renal failure, which required dialysis regularly each week and would quite possibly eventually require a transplant. And another life-limiting illness was a throat swelling condition, which, if not adequately treated with medication, could actually cause his death. And indeed, at least one other family member had died of that particular life-limiting illness. He was surrounded by an extended family. The details are there: a stepfather, a sister, and a brother. But they did not know the extent to which Andy was not engaging with healthcare, particularly delivered through the acute hospital that was responsible for attempting to manage his renal failure and to provide him with dialysis 3 times a week. They were not aware of his failure to keep appointments with the Department of Work and Pensions, which had resulted in him not receiving benefits, with the outcome that he was living in quite extreme poverty. They were not aware that he had dropped out of mental health assessment, which had been arranged for him during one of his hospital admissions when one or more of his life-limiting illnesses were out of control. And when I met them on 2 occasions as part of completing the Safeguarding Adult Review for Salford Safeguarding Adult Board, they expressed considerable disappointment and frustration that none of the services attempting to support Andy, and that included adult social care, had contacted them to see whether they could be an active circle of support to enable Andy, or to facilitate Andy's engagement with dialysis, mental health assessment, welfare benefit arrangements, and so on. And they reflected that the assumption was that Andy was exercising lifestyle choices, that Andy was self-neglecting, that Andy was uncooperative, disengaged, aggressive, angry. And they reflected that actually he was not intentionally doing any of those things. But that at times he was so tired, so fatigued, so hungry, so cold, that actually he was unable rather than unwilling to engage. And had they been contacted, they might have been able to have supported Andy, taking him to hospital, for example, for his dialysis appointments. So the learning is, are we too hesitant, too reticent to reach out to families to explore what they might be able to offer a person with significant care and support needs? The third human story you can find on the Swindon Safeguarding Adult Board website. It's a case known as Honour. And this is a case about domestic abuse. This is a case about a carer, in this case an adult son, and a cared for person, in this case Honour, his mother. And there were periodic concerns over a period of time that Honour's adult son, with whom she was living, was physically and financially abusing her. And on the majority of occasions when practitioners spoke to Honour, they spoke to her at home and in the presence of her son. And it should come as no surprise that on those occasions she denied that there was any abuse, physical, financial, neglect taking place in the home. On a couple of occasions, she was interviewed quite appropriately away from home. And on those occasions, she began to disclose that indeed there was abuse and neglect taking place. And there were opening conversations in line with making safeguarding personal about what she might wish to be the outcome of such disclosures. But those initial discussions were not really followed through, principally because the case was not seen through the lens of domestic abuse, was not seen through the lens of physical or indeed financial abuse, but was seen through the lens of a stressed carer who needed support. And the majority of the interventions that took place through that particular lens, rather than through the lens of recognizing that here was a person who needed to be involved in how best to protect her from the abuse that she was experiencing. So that's Honor's story. And then the story of Mr. K that you can find on the Bexley Safeguarding Adult Board website. And this story is one of several I could highlight that involves the linkages between children's social care and adult social care. So the story here is that a school where I think it was 3 children from this particular family were attending, the school was very concerned about how the children were presenting at school and referred the case to children's social care. And practitioners from children's social care visited the home and shared the concerns that were being raised by the school. And indeed, children in need and child protection procedures followed the initial assessment triggered by the referral from the school. As part of the initial contact between children's social care and the family, mother and father, as well as children, children's social care referred the father, Mr. K, to adult social care, concerned, as it says on the slide, about his self-neglect and his mental health. And the assumption appears to have been that adult social care would pick up that referral and would follow through on it, and if necessary, involve other adult services, particularly mental health, in meeting Mr. K's support needs. There were also concerns about domestic abuse, the relationship between Mr. K and his partner, the mother of the children. There was some focus on that in relation to children's social care, talking with the mother, but there was no involvement between children's social care and adult social care in relation to domestic abuse and adult safeguarding. The upshot was that children's social care thought that adult social care would pick up the referral. In fact, adult social care did not. Children's social care focused principally on the welfare of children and did not focus on the whole family, including Mr. K. So the key learning here is about how children's social care and adult social care construct a whole family intervention when it is clear that there are needs, healthcare needs, social care needs in relation to the parents, in addition to needs relating to the children. And this is one of the cases that makes me reflect about my career in social work and social work education. When I began as a qualified social worker, I was allocated families. I wasn't just allocated the children. I wasn't just allocated adults. I was allocated and worked with the whole family. Latterly, of course, we have subdivided social services into children's social care and adult social care. The danger of that arrangement is that we fragment families and we fail to provide a whole family approach. And Mr. K's case is one example where services failed to provide a whole family intervention. So what do we learn from these human stories? What do we learn from these safeguarding adult reviews? We learn about the importance of a partnership culture that always thinks family, and that culture is evident in both the strategic partnership arrangements and also in operational work. So in Bristol, actually, you have taken the culture of thinking family to what some people would argue is its logical strategic conclusion, and that is that in Bristol you have combined the Safeguarding Adult Board, the Community Safety Partnership, and the local Safeguarding Children arrangements. In South Gloucestershire, you haven't done that, but nonetheless you may well have strong strategic links between the different partnership arrangements that are responsible for adult safeguarding, children's safeguarding, and community safety. And whichever arrangement you ultimately adopt, what is important is that there is a strategic commitment to, underpinned by protocols, procedures, policies that seek to create a culture of thinking family, including shared records, overlapping carer assessments, and established governance arrangements about who leads on issues to do with domestic abuse, exploitation, discriminatory abuse, most evident in hate crime, who leads and which services support the leadership being undertaken by one of the governance arrangements and one of the departments within the local authority and beyond. So the importance of a strategic commitment to thinking family. And then the importance operationally, as indeed was evident in the learning from the case of Mr. K in Bexley as an example, the importance of close collaboration between children's services and adult services that ensures a whole family intervention. And if that is not going to be provided by one social worker or social care worker or one community psychiatric nurse, as it might have been when I was a frontline practitioner, then the importance of ensuring that those practitioners, plural, who are engaged are working very closely together, including, when appropriate, joint visits, and that the whole system, both health and social care, housing, and where appropriate beyond, come together as one system to ensure that the needs of both the children and the adults in the family are met. So I would invite you to reflect on the degree to which, as frontline practitioners and operational managers, your experience of work is just that the system meets, the system comes together and resolves together how best to intervene to meet the needs of children and families, to meet the needs of adults with care, health and support needs, and anyone those adults may be caring for, and considers the circles of support that might be available within families and their wider networks for those people who do indeed have care and support needs and might be at risk of abuse or neglect. So in terms of working with individuals and their families, what do these human stories remind us about? I think we need to challenge ourselves and challenge each other about the degree to which we may be reticent about seeking information from families, neighbours and friends. My view is that we are not infringing a person's right to private and family life if we reach out to gather information from people who may have something useful to contribute to our understanding of a case. I think that is a key message, for example, from Christopher's case in Bristol and Andy's case in Salford. If practitioners in those cases had reached out much more than they did, particularly in Andy's case, to gather information from family members, from friends, from neighbours, they would have had a much fuller understanding of the individual who was the focus of their concern. Similarly, are we unduly reticent, perhaps because of misunderstandings about what the law allows in relation to sharing information? Are we too reticent to share information with each other as practitioners and indeed with family members in order to safeguard and promote the well-being or welfare of children or adults at risk? The Data Protection Act 2018 allows us to share information proportionately when it is necessary to safeguard and promote the well-being of a child or an adult at risk. So are there occasions when in fact it would be appropriate in relation to cases with which you are working and perhaps struggling, where it might be appropriate to share information with other professionals, with other practitioners, or where it might be appropriate to share information with family members because you are concerned about how best to prevent further likelihood of abuse or neglect? Are there occasions where actually you could involve family members in exploring the degree to which they could be a circle of support? Are there occasions when you could reach out to family members who may or who may not be providing informal care at the point when you are reaching out, to explore what contributions they might be able to make, or indeed, going back to the point about information gathering, what understandings they may be able to share to inform your intervention? Are there cases where actually you need to map with the individuals involved the nature of changing family relationships and dynamics, all of us who are living with partners, who are bringing up children, who have brought up children, who are part of wider family networks, will recognize that relationships and the dynamics within relationships change over time. How good are we at actually mapping those changes and talking about those changes? For example, what is clear if you read the case of Honor on the Swindon website, what is clear is that no one really understood or sought to understand the history of the relationship between Honor and her adult son. Was it always a relationship that was characterized by abuse, by neglect, by relationship strain? Or indeed, was that a more recent change, perhaps as Honor became more disabled, or perhaps as the son had to pick up more care responsibilities than he had been used to hitherto? And the importance of understanding relationships is illustrated by some domestic abuse cases, which highlight that in some cases, it isn't as simple as identifying one person who is a victim and one person who is a perpetrator. Some relationships are actually much more complicated and much more complex than that simple binary division. There is an established method of working with families known as family group conferencing that may well have something to offer when you are seeking to establish the degree to which family members may be a circle of support for an individual with care and support needs. But the final point I wish to make in relation to this slide is learning that is hopefully familiar to children's services colleagues, particularly those practitioners engaged in child protection, but is perhaps less familiar to our adult social care colleagues. And that is the danger of the rule of optimism, always believing that actually things will turn out all right in the end. What the case of Honor in Swindon demonstrates was that that rule of optimism was evident in the lens through which that case was being seen. Namely, that if we supported the son and tried to reduce what we believed to have been his carer stress, everything would work out fine. We have to guard against the rule of optimism, and each time there is an episode of concern, treating that episode of concern as if it is the first time that it has arisen, rather than seeing the latest episode of concern as part of a repeating pattern. So, what are we learning? We are learning that we need to improve, for example, our understanding and use of pathways into both children's safeguarding and adult safeguarding. And we need to ensure that we are fully aware of the legal options that are available to safeguard not just children at risk of abuse and neglect, but also adults. We need to recognise and assess people's care and support needs, and when those needs are being presented in a whole family context, we need to ensure that we are addressing the needs both of adults as well as children. And we need to ensure that the whole system is working together, and to avoid assumptions that just because we have referred a case elsewhere, that referral has been picked up and is being dealt with. We need to be, particularly in adult safeguarding, much more alive to the potential of of multi-agency meetings, multi-agency panel discussions. We need to have a culture in adult safeguarding that recognises the value of bringing everybody together. That is much more established in children's social care than it is in adult social care. We need to ensure we have a culture where any organisation can say, you know what, we need a whole meeting, we need a whole service meeting, a multi-agency meeting to share information and to explore how we can address and mitigate the risks in a particular case. And in relation to adults, we need to be much more alive both to the impact of adverse childhood and adverse adulthood experiences, loss, trauma, underpin self-neglect most certainly, and other forms of abuse and neglect very often. We need to be much more alive to a person's history and seeking to understand the impact of that history on how a person engages with the world in the here and now. And in relation to people who have problems with alcohol and drugs, but in relation to people who also self-neglect, who also put themselves or find themselves in situations of risk of abuse and neglect. We need to be much clearer when conducting mental capacity assessments that we are assessing not just what they say, but what they do or don't do, and feeding back into our assessments and our conversations with people what we observe them doing or not doing, and seeing whether they can use and weigh our feedback about the situations that are surrounding. And that's executive capacity or executive functioning. We need to think creatively and collectively. We need to avoid dumping cases. It's not good, as was demonstrated by the Bexley case, simply to make a referral and think job done. We need to follow up those referrals. We need to explore with the agency to which we've referred a case what we might actually be able to offer as part of that agency picking up that particular referral. We need to think about the contribution of all the services to meeting the needs of adults and children. So the importance of wraparound support and where that support might come from. And we need to create a culture where candor, challenge, escalation of concern is recognised as being core components of the very best practice. And we need to make sure that all voices are listened to. So the Christopher case highlights the importance of listening to the voices of family members, extended family members, as well as listening to the voices of practitioners and indeed Christopher himself. In other cases, we need to make sure that the voices of all of the practitioners involved, from statutory services and from third sector agencies, are listened to and given parity of esteem. And final word, and in line with making safeguarding personal and messages that I have tried to convey this morning, it's appropriate to give the final word to a service user. And this is Helen's message to us. And it's reported in the Safeguarding Adult Review that you can find on the Luton Safeguarding Adult Board website. And it's a direct quote from her. What hope do I have to ever recover or feel better when this keeps happening? I encourage anyone who truly cares to come and spend a day with me to see what it's like to be helpless when days feel like weeks and weeks feel like months. And what was the context of that contribution from Helen? Helen was a disabled person. She was an adult. She was a mother. She had a son who also had disabilities and care and support needs. Children's Social Care tried to involve other agencies in supporting Helen and her family network. However, that attempt did not secure a whole system think family approach. And there were delays in assessment, there were delays in service provision, particularly from adult social care, and a failure to involve all the family when in fact some family members were providing significant contributions to the disabled son in particular. What I think Helen's quote reminds us all of is the importance of humanity. And what she is alerting us to is the danger when we forget as services that we are actually working with human beings, and where quite possibly it could be us, if not now, at some point in the future, who will be reliant on services getting it right. Services in this case did not get it right for Helen, and may well have forgotten that they were actually dealing with a human being with very real needs, with very real hopes, with very real frustrations. We should not forget the importance of humanity. That's the end of my formal presentation. You'll see that there are a couple of references at the end in case you're interested. The first being the report of the National Analysis, which will be published hopefully by the end of October or beginning of November on the Local Government Association website. But in addition to whatever questions you may have, I thought that it would be useful just to begin to get us thinking about the implications of what I have said today. So there is the chat box, and you should also have the hand function. I'm not sure whether I'm going to be able to see the hand function, but hopefully Esther and anyone else from either South Gloucestershire or Bristol Safeguarding Partnerships can help me manage. So I will now fall quiet and see whether anyone wants to ask questions about what I have said, raise issues about what I have said, or indeed respond to the questions I've put up for discussion. So it's over to you, and thank you for listening.